Hi, Premier.
Hi,
just for clarification purposes, the fines, just to be clear, do they apply to just the hosts of these gatherings, or, I mean, you mentioned on top of the $750, is it just for the hosts, or is it for like anyone who goes to a gathering like this could face the $10,000?
No, it's the host that's going to be charged $10,000, and individuals that show up to the parties, it's going to be $750. And Lucas, you know, this is frustrating for all Ontarians when you have these people that just recklessly ignore the regulations and guidelines that the chief medical officer has put out there. And you know, I sit back, Lucas, sometimes and wonder, you know, they must be a few fries short of a Happy Meal, these people, because I don't get it. They go out there, they know the rules, and they just blatantly ignore it, and they're hurting families. They're hurting seniors. They're hurting everyone when they do it. And when we were doing the tracking and tracing, and I talked to other chief medical officers across the province, I'm hearing the same story, telling me that these are in social gatherings. It's just reckless, and it's not fair. When you have 99% of the people out there, probably even higher, following the guidelines and the rules, and then you have these people going out there and just snubbing their nose to their neighbors and really all other family members, and they hold these big, huge parties. It's unacceptable.
And Premier, and this is maybe more so for the Minister of Health as well as Dr. Williams, one of the, obviously the big responses we've gotten in response to the gatherings is the fact that the current rules around the caps in certain classrooms for certain grades are remaining the same. And of course, the NDP has their motion to mandate even further. I'm curious if the explanation to this, why you wouldn't do more on class sizes when you are doing more on indoor gatherings. I mean, do you just see this as simply an apples and oranges comparison, where you have structured rules in place for schools where you may not have them for those more informal gatherings?
Well, it's total, and I will hand it over to the Minister of Health and both Dr. Williams as well, but we're comparing apples and oranges here. We're comparing a school that have cohorts and have the teachers there supervising and have social distancing and wearing masks and hand sanitizer and having nurses on hand, and comparing it to a wild party in the backyard that people are drinking, hugging, kissing, spit, and every other thing that you'd possibly think of, not paying attention to the rules, spreading COVID. It's unacceptable, and it's just apples and oranges. But we will hand it over first to the Minister of Health, then Dr. Williams. Thank you.
Well, thank you. I think the Premier has put it very well. We're talking about an entirely different situation between the plan that has been set up in our schools to protect our students and these totally unmonitored social events where none of the public health rules are being followed at all. What we have in our schools is a situation where people are in cohorts, they are wearing masks, they are achieving the physical distancing that's required, following the hand washing routine, and so on. None of this is happening in these unmonitored social gatherings. But I would ask Dr. Williams to please come forward with his medical view of the differences between the two.
Well, thank you, Premier and Minister. And they've answered the questions really well. They've heard it all before, and that's really good. And we want everyone to understand that when we're dealing with our schools, we've set up a large structure of how to handle that, where people are asked to do a self-assessment tool themselves or for their children before they even go to school, to undertake rules and practices to not go to school, to stay out, to undergo testing when necessary, and to monitor symptoms and signs. As a minister already noted, we have cohorts in the classrooms. This is not a new group of people assembling every day. This is a group that's come together under the direction and leadership of the teacher in the classroom, and the school has set these out. This is quite different than what the Premier is talking about, where you have a bunch of people, some not even sure who's coming, and you have large groups and gatherings. You don't know if they brought illness with them, where they've been. You have no idea of what the practices are. There's usually very little. There's no masking, no social distancing. And these are the events that we really do not want to have happening, because they contribute to the cases in our community and spread around in our community, and that invariably can roll back into infect our schools. And we said before, we need those numbers down to make sure that our systems and processes in schools are not only working well, but they're backed up by the support of the community and everybody doing their part, as the Premier had noted. So quite different, as you said, it's apples and oranges in the comparison.